Welcome everyone, and thank you for joining us today. My name is Corinne Pullman. Some of you may know me as one of the co-hosts, but I'm here to do the quick introduction today. We're happy to present to you our COVID-19 update webinar with our special guests from the Public Health Agency of Canada. Before we begin though, I just want to make a few technical notes about the GoToWebinar platform. You'll see on the webinar panel, which is the blue or orange flower icon on your screen, you'll see the handouts panel. Here you will find today's presentation. There's also a question panel where you can enter your questions for our panelists today. We try to answer as many questions as possible either through the chat box directly to you or during the live Q&A session at the end. On this particular one, we'll have them both in the middle at the end. Following the webinar though, please take a moment to complete a short survey letting us know your experience today. You'll receive a recording of the session next week, Tuesday, by email. I will now introduce Laura Jones, our Executive Vice President and Chief Strategic Officer.
Hi everyone, and I think I can safely say good afternoon to everyone because it's afternoon everywhere in the country today, and we usually do these on Thursdays, but here we are on a Friday, and I just want to say a special welcome to those of you who are joining us either for the first time or this is now our 50th regular COVID webinar. I can't believe we're already on episode 50 of these webinars. We started these early in the pandemic to really try and make sure that we had as much information, we were getting our members as much information as we possibly could in a timely, digestible way. And we've been doing them regularly right since the beginning of the webinar with my co-host Corinne, who you just heard, and also Brendan and Rachel have been very regular contributors. Today, I'm happy to say we've got a special focus on public health and getting your questions about public health matters answered. So we have a guest with us, Kerry. I'm going to introduce her in a moment, and I know there's some other folks in the background helping to answer questions from public health. But given today's special focus of the webinar, we're going to focus on that for the first half an hour, and then we'll get back to some of our regular updates that we do, just give you a few updates about what's happening with programs across Canada, restrictions and programs that are available. But given today's topic, I did want to, obviously we're going to be talking a lot about vaccines because we're at that point in the pandemic where vaccines are available, and also vaccine rates have been tied to provincial reopening plans. And so I did want to preface the conversation by saying we do know there's a wide variety of perspectives on vaccines. And certainly that's true among our members as well, and we do respect that. Our role at CFIB is to get your questions answered and make practical tools available to your business, get you the information that may be helpful as you're making decisions and thinking through how to run your business and how to navigate reopening. Our role is not to try and advise people on health matters, and our role is not to convince people who don't want to get vaccinated to do so. That's why we're also working very hard to make sure rapid testing is available. Alternatives to vaccines continue to be available and widely used. However, we do have a guest today, the Public Health Agency, and we're really happy they've agreed to join us. We know many of you supported the idea of having them on, and they're here to help answer your questions, and their role clearly is different from ours in terms of encouraging vaccination. So I just wanted to make that note because we've had comments, including comments on the webinar, about vaccination. So we're here to answer your questions and get you the tools that may be helpful for you to use in your business. And with that, I want to go to our commitment that we always make. So on the next slide, we've got our commitment to keep our website up to date and to make those tools available to you. We've got the helpline number here, and our counselors are always happy to take your questions and they take questions on a wide variety of topics. So if you're not sure whether we can help, pick up the phone and give us a try, and we may just save you some time and money. So that's always an option available to you. On the next slide, So as I mentioned, the key, we're going to get right to it in a moment with the Public Health Agency, and then we'll flip what we usually start with, which is what's new. We'll flip that to the second part of the webinar, and of course, answer as many of your questions as we can throughout the webinar. And so if we go to the next slide. I am really happy to introduce Kerry Robinson, who I'll ask to share her screen now. And she works with stakeholder relations for the Public Health Agency of Canada. And I think, Kerry, you've been doing that for the last 5 years, if I'm not mistaken, but you've been with the Public Health Agency since 2007, so for a while in different roles. And I also understand that you like hiking and biking. So I've just recently taken to getting my kids outside every weekend on a hike, which is proven to be good COVID relief medicine, a little fresh air and forest bathing. So we're really happy to have you on the webinar. I'm going to turn things over to you and let you say anything else you want to say about yourself, and then get straight to the slides, and then I'll be back with some questions. Corinne and I will be back up in a few minutes with some questions for you.
Sounds great. Good afternoon. Thank you very much, Laura and Corinne, and for the invitation to speak with all of you today. So thank you to the Canadian Federation of Independent Business for having us join you today. And I think I won't say anything more as words of introduction, but just to say that part of our role at the Public Health Agency of Canada is to provide credible evidence-based information to help Canadians and businesses and partners in a whole range of sectors make informed decisions and help contribute to the COVID response. So I actually want to acknowledge all the many sacrifices that all of your organizations have made over the last year or so. Small, large, and we've all put in incredible amounts of efforts to help Canada respond to the pandemic in the most safe way possible. It's been a very challenging year, both in terms of personal, professional, and just life in general. So I just want to start off on that note. I do want to spend a few minutes providing a bit of a situational update on COVID before I talk a bit more about vaccine rollout, and then have some opportunities to talk about either guidance for businesses and workplaces and some of the questions and answers that you may be seeking. So nationally, we're seeing some quite hopeful signs that we've passed the peak of the third wave of COVID-19. We're on our way down that peak, but resurgence is still possible. And as you know, this peak was much higher than the first wave, than the second wave that we had of the pandemic experience in Canada. And that's pretty similar to what we're seeing in many parts of the world. In fact, you're still seeing some countries that thought they had beat it for it to come back again. And it's because of the virus circulating so much, and as well having all those variants of concern. So we have seen, through this third wave, persistent and high numbers of severe and critical illness that's placed, as you can see in the media, very prolonged and heavy strain on health systems and the workforce as a whole. Our latest analysis that Dr. Tam and Dr. New presented today shows from our national data and modeling that public health measures are working to reduce the impacts of COVID on individuals, on communities, and on our health systems. And while there have been different experiences across provinces or territories or regions of Canada, overall at a national level, we're seeing a decline in the number of cases and in those indicators of severity in terms of hospital use or intensive care. The death rates aren't the same as they were in previous waves, and we're beginning to see a downward trend on that and hope that that continues. I will say that depends on what we do over the next few weeks and months ahead. So the national effort around vaccination rollout of safe and effective vaccines is, our goal there, if I could advance to the next slide, is to really try to vaccinate as many people as quickly as possible to protect everyone in Canada. And this is accelerating well. You can see the key components of the strategy over time that we are working closely with our partners at all levels of government on. Based on increased supply of vaccines and public health guidance, it's allowing us to extend the interval between the first and the second dose up to 4 months. Canada is able to maximize the protection from COVID to as many individuals as possible sooner, and especially when we're in a third wave, that was really important for us. Ultimately, it is up to each province and territory in terms of the decisions they make around how they use vaccines within their programs, and those decisions are based on the level of COVID activity they're seeing in terms of outbreaks and hotspots, the vaccine supply that they have, especially in terms of where they have it located across their province and territory, and things like geography. We are seeing in the last couple of weeks some provinces and territories begin to shorten the time frame between the first and the second dose, and that's always what our guidance has allowed for. What we were challenged with, as you know, is limited supply of vaccine in those early weeks and months. We're not in that situation now, so as there's more vaccines, you're going to see that there will probably be some shortening in terms of that time frame, which is really good news. I will just say that on the positive side, what we've actually seen from some of the vaccine evidence is that in the real world in terms of effectiveness is that in some cases, in many cases, in fact, extending the interval beyond the 3 and 4 weeks that the vaccine companies had identified as the appropriate interval actually boosts. So the longer you wait, and I don't mean months like 4, 5, 6, 7 months beyond that, that's too long, but definitely extending beyond 3 and 4 weeks can actually build our immunity more. That's actually based on sound immunological principles about how vaccines work in our system. The longer our body has in those first few weeks to build immunity, the second dose can even boost it higher. So it's been to our benefit, actually. It's been a very good decision taken in Canada. I want to advance to the next slide, please. We have a couple of slides that we're sharing here around the development process for vaccines in terms of approval, safety, and monitoring. And one of the challenges that we've had when you have a brand new virus like this is that the evidence in terms of the science, the knowledge around how it behaves, how it mutates over time, what strategies are most effective to control it and to reduce transmission, and then the development of vaccines, that has emerged and changes on a rapid basis. And you can see that our guidance is evolving along with that because we're trying to follow the best science and evidence. So what we knew a year ago is not what we will know now, and we all know that we need to stick to what is the latest and greatest in terms of what's going to have the biggest impact. And as a result, our responses are stronger and better. So when we talk about vaccines, of course, there's a very strong process that's been in place to develop vaccines rapidly with a race in science across the world and incredible collaboration, as well as investment in resources to a much greater level than we've ever seen before. All of those things together means that we've been able to achieve a great scientific achievement in terms of developing the vaccines and launching them less than a year after the first virus was detected. And we've shared here with you this overview about vaccine development and how it moves through the stages of discovery trials with thousands of individuals. But since those clinical trials have been completed, we actually have, over the last number of months, been informed by real-world evidence on the vaccine effectiveness through immunization of people around the world. Globally, we have about 1.8 billion people that have now been vaccinated against COVID-19. So that's why we're starting to see these trends, along with the public health measures that are having this impact to reduce cases and transmission. So next slide, please. We're really confident that our top experts and scientists and health professionals have carefully reviewed the scientific data and evidence for vaccine safety, manufacturing, quality, and effectiveness. And Health Canada takes this very seriously, and that's why they also put up regular updates based on what they're seeing for looking for any signals. And we have a very robust and well-respected vaccine surveillance systems in place to monitor effectiveness and address any adverse events, and regularly report on those results on our canada.ca website. Governments have and they will continue to take rapid action if there's any safety signals that have been identified. Like any medication, of course, vaccines can cause side effects when they're administered. The most common side effects are things like pain at the injection site in your shoulder, some redness or swelling. Those are normal. That is an expected reaction, and they generally pass in a day or two, including things like having a fever or some aches and pains, often passing in a day or two, and some, Tylenol or acetaminophen is one of those approaches that can help just to manage that. In terms of timelines, I'll maybe move to the next slide. We are positioned to receive more than 40 million doses of vaccine before the end of June. That's what we call our sort of second quarter of this. So we did start this journey back in December when we launched our National Operations Center. Now in this spring, we're focusing on 1 dose for all eligible adults. Or I should say individuals, because now many jurisdictions have, in fact, I think all but 2 have increased the age so that those eligible are 12 and up with the approval of the Pfizer vaccine for that age group and higher. And so we have enough doses to vaccinate all Canadians, all individuals in Canada before the end of June, and with that 40 million doses. But we're also going to be having more doses come into the summer to allow us to, and some jurisdictions are beginning to do the second dose administration. To date, close to 23 million vaccine doses have been administered, and 26 million delivered across Canada. So yesterday alone, we had 400,000 doses delivered. And so with that, you've seen a very rapid increase. We've actually had more vaccine in the last 5 weeks than we did in the previous 5 months. And we're now at a coverage level that is higher than the United States in terms of one dose. So about 55% of the Canadian population have received one dose. If you think about the eligible population of 12 and over, it's an even higher percentage. So that's excellent news. We're starting to build the population protection in Canada. As our Prime Minister and Dr. Tam have mentioned, we are aiming for a one-dose summer or better. If we can move those doses out faster and people can get their second dose into in the summer and before the fall, that will allow us to begin to gradually return to some normal activities. Next slide, please. We have guidance and updates on the approved vaccines. There's 4 vaccines that are approved for use in Canada, 3 of which we actually have supply in Canada that is being used and administered. And that's helping us to rapidly roll out and scale up these vaccines. With respect to guidance, it's important to understand the different roles that organizations have in Canada on this front. And so we have Health Canada, who is the regulator. They review and approve the science to authorize the use of vaccines in Canada. We also have the National Advisory Committee on Immunization, and they're an independent committee of experts, health professionals, researchers, that provide all levels of government, the federal government, provinces, and territories with advice on how best to use the vaccines that are currently or newly approved. And they draw on international evidence as well as Canadian studies and modeling in terms of how best to use those doses to have the greatest public health impact. And there's now data and evidence from Spain and the UK starting to be released on a mixed dose schedule of vaccines. So this is something I know everyone is interested in hearing about. And the National Advisory Committee is expected to release new guidance on that front in the next week or so. So that's good news because that will help us and provinces and territories make those decisions about how best to use the vaccines that they do have available. And it's important to note that, a second dose of AstraZeneca, for those that have received AstraZeneca, we have the supply in Canada for Canadians to receive that second dose should they choose to. And that is part of further guidance that we're going to be having. But certainly provinces and territories are already starting to do that and is safe and effective to do so. So it's important to have those discussions with your healthcare provider if you're wondering. But for those that are worried, will I have my second dose? Absolutely, you will. The timing of that is going to be dependent on each province and territory's decision about the supply that they have and the hot spots and other factors that they're seeing. Next slide, please. So we're having this webinar today because we want to talk a bit about the opportunities for industry, the private sector and businesses in particular, who play a crucial role in the pandemic response and in our recovery in Canada and ensuring successful vaccine rollout. There's some key ways that business sector is already supporting the vaccine rollout, and that includes being leaders in terms of corporate social responsibility and ensuring that people have credible and evidence-based information on vaccination to inform decisions. It's important to look at ways that we can support a movement to encourage eligible employees to seek vaccination. So, and also providing supports like paid time off so that they can get vaccination in clinics nearby them. And finally, supporting administration of vaccines where that capacity exists and if that need exists. So we have seen to date some excellent partnerships between business sector and industry and jurisdictions like provinces and territories that are really amplifying and maximizing the vaccine rollout in terms of those campaigns, especially in large workplaces. And we're beginning to see that's having an impact in many of the regions in Canada that were hit most hard during this pandemic, a third wave, and where our healthcare systems were overwhelmed, and in some cases, such as Manitoba, continue to be overwhelmed, where we're seeing patients have to be transferred to other provinces or perhaps the U.S. in order to get the care that they need because of the pressures on the health system. So this is real. And so we're happy to see, for example, some of the partnerships between Cargill and JBS Foods, for example, in Alberta are vaccinating their 15,000 employees working at meat processing facilities. Maple Leaf Foods also administering vaccines in their Brampton and Mississauga plants to really help ensure that there's that kind of coverage and protection in their workforce. And we've seen other partnerships For example, underway, we're working together with Uber and Uber Eats to promote vaccination. We also have other industry-led initiatives such as the Roundtable on Testing, Screening and Tracing and Data Management that's really bringing together leaders and industries to provide advice that's informing how we're rolling out testing, contact tracing and data management. I don't want to underestimate the role that testing can play in this pandemic response. We're seeing more recently reductions in the number of people that are getting tested, and I think some people are choosing, I don't want to get tested. I don't want to, instead of the isolation impacts. I can say personally, I got tested myself this weekend. I had a little cough. I was wondering about it. I went and got tested. I was in and out in 10 minutes from that clinic, got my results within 24 hours. And then that gave me peace of mind and to my family as well, that I wasn't exposing them. So it's important for us to encourage access to testing and to consider ways that we can ensure that people do go get tested, even if they have any symptoms that they're worried about or if they've had contact with others, because that's one of the key ways. We can't stop the virus unless we know that it's there. So the Faster Together campaign is another business labor-led initiative to boost vaccine confidence in over 60 organizations. We value all of these kinds of examples and efforts of business and industry to promote testing, to promote the public health measures we know that work, such as physical distancing and mask wearing, especially with those outside of your household, and then to support vaccine rollout. If we can move to the next slide, there's a number of pieces, and we highly encourage, there's some key guidance and resources. Many of you probably checked some of these out already, but I will say that one opportunity for you to consider is to be an ambassador for COVID vaccination. And that means just sharing credible information on vaccines from and with your communities. And so we've got a link there to a bilingual toolkit that includes a range of different resources on COVID as well as on COVID vaccination. It gives us sort of the science-based facts about vaccines, how they work, and some of the key questions that are asked. We also encourage you to champion the healthy practices that we know are effective, and I know we'll talk a little bit more about that in a couple of minutes. But we want to encourage you also to consider, we can move to the next slide, the resources that are available through the Canadian Centre for Occupational Health and Safety, and they have a number of tip sheets and guidance to prevent the spread of COVID in workplaces. I'm sure many of you have taken advantage of those resources and are in fact implementing those practices over the last year in your businesses. It's important to know that provinces and territories are adjusting measures, the public health measures in their jurisdictions based on what they're seeing in terms of low cases and control of the virus, vaccination, and pressures on the health system. So it is important to look at and understand the system and the context that you're in, the situation that your organization or business is in. We have also on our PHAC website a risk mitigation tool. So we've got here a link for you to some of those guidance documents, the awareness resources, and including in that is a risk mitigation tool that allows you to look at the ways in which you can modify aspects of the working environment. So do encourage you to consider being ambassadors of vaccination. You've got those resources that can support you. One thing I'll just say is that it is crucial for us to stick to the public health measures we know work right now. It's very tempting to say, well, everything's improving, things are going down, let's fully open things up. There's a reason we're taking a cautious approach. Our modeling shows that if we were to lift the public health measures right now when we don't have the high vaccination coverage yet, that we would actually probably result in overwhelming our health systems and having another resurgence. And that's something we want to avoid. No one wants to go back to the lockdowns anymore. People want to come out the other side of this and continue in that way. We're seeing that it's important for us to reach the 75% one dose coverage, 20% two doses this summer, so that we can allow for some small outdoor gatherings and start to ease some of those measures. But having a high two-dose coverage for everyone 12 and up before the fall will allow us to look at other kinds of measures. For example, maybe reducing or eliminating the need for masking and physical distancing and allowing more indoor gatherings in fall. We know that's what everyone wants to get to. So it's not just vaccination that will allow us to ease measures. It's also the public health measures that we're doing right now, because the virus is still circulating in our systems. The variants actually are more transmissible than what we were used to a year ago. The virus is different, and we're trying to learn from other examples like the UK and Israel in terms of things that they have found work. So it's going to be a cautious and a gradual approach this summer, vaccine rollout is progressing very well, and we're really happy to see that and how it's moving ahead. But those combination of things, the personal protective practices and vaccine rollout, those things together will allow us to build up population protection. And I think I'll stop there, and happy to answer any questions you may have.
Well, thanks so much, Kerry. I know we have you for about 5 or 10 minutes, so we're going to try and do some rapid fire at you. So, Corinne, you've got both Corinne and I up here. Maybe I'll start with, I think this might be a quick one, but Zoe is asking about if you have any update regarding the trial of mixing vaccines, so that first dose of AstraZeneca, second dose of an RNA vaccine. Any updates on what's happening with that?
Sure, I did mention it briefly in my remarks, but the National Advisory Committee on Immunization, they're actually in the process of finalizing their guidance right now on this very issue, and we're expecting that to come out very likely before the end of next week. So we're all waiting with bated breath for that. What we know from the UK evidence to date is that they have released and published data showing that there are no safety concerns with mixing vaccines. With having AstraZeneca followed by mRNA or mRNA followed by AstraZeneca as an example, or a viral vector, I should say. So there are no safety signals on that front, which is good. That's a really important piece. We've actually gotten some new data from Spain's experience of mixing vaccines as well. So between those two things, that's informing NACI's decision and the recommendation that will come out very soon. So that's good news that we have studies and randomized control trials to provide that. So this is not anecdotal evidence. It's not what people are reporting, their individual experience. It's good, solid research. So Canada's benefiting from the experience that we have from other countries on this. But it's going to come out very, very soon. And what you're going to see provinces and territories making decisions in rapid fashion to then inform the second dose strategy.
Great. And I'll ask you one more, and then I'll turn it over to Corinne to ask a couple. So not surprisingly, of course, as the vaccination rates are going up and the different provinces are at different stages of lifting restrictions, but this opens up a whole new Pandora's box of questions. And Susie from Ontario, she owns a gymnastics gym, and of course last fall the advice was, not to touch the kids, to wipe down all the surfaces, so she's wondering how that advice is likely to change as we head into this fall.
I can't give specifics about if you're in Hamilton or if you're in Nova Scotia, what the advice is going to be from those provinces and territories at the time. But I think what we're seeing is that the vaccination, the public health measures, the control of bringing the cases down are going to allow us to lift some of those key things. So we expect that we're going to be able to gather, we hope that we're going to be able to gather in the fall indoors in ways that we have not been able to without some of those measures. So if we can get, 75% vaccine coverage with 2 doses for everyone 12 and up, then we think we can start to lift some of those things like the masking, like the physical distancing, that will then mean something like gymnastics is much more feasible to do than it has been to date. What we are seeing from the evidence is that the focus on cleaning of surfaces is perhaps not as necessary as we thought it was in the early days. So I think there aren't a lot of strict specific requirements for that. It's generally guidance and advice to do so. So I think we've learned a lot about how to keep things cleaner, especially high-touch common surfaces, that still makes sense to do. But the wiping down, the disinfecting, the leaving for hours in between different groups, those kinds of things are probably going to change, especially if we have greater population protection. So I can't give a crystal ball, but certainly there are going to be adjustments in the kinds of advice that comes out, especially once we see that the virus is controlled through the summer.
Thank you.
So I also, a couple questions from my end here. Catherine from Ontario owns a small retail store and that serves customers through curbside pickup and delivery and shipping. Her employees are now all vaccinated, as are their immediate families that they live with. So she wants to know, is it safe not to wear masks in the store? And if they do not wear masks, she suspects it's best to keep the 6-foot distance. But what are the recommendations for something like that? They do wear the mask when they serve customers, though, but just when they're not serving.
So the thing is that 1 dose is not the maximum protection. A couple of things people really need to know is that, especially for older adults, the vaccine don't start to come into effect in your body until at least 2 weeks, sometimes 3 weeks. So it's really, people think, well, I got my vaccination, a week ago, I'm good to go. Actually, you're not. Your system is still building that up. So it's really important for everyone to know that you need to carefully follow measures for that extended period of time. But secondly, I don't think I heard that they were fully vaccinated with 2 doses and that everyone is. So if they're not, that's not foolproof. So in fact, we are still at a point with the level of virus that is circulating and the variant, the physical distancing and the mask wearing indoors is absolutely important to do right now. If we were into the fall, if we were fully vaccinated, 2 doses for everyone, and the virus not circulating actively, that's different. But the virus is very much there. And in fact, it's not just about an exposure risk with the customers outside doing the drop off and pick up. In many cases, it's actually the transmission happening in the workplace. It's happening between employees together in a small space. So it's not just about the physical distancing. We would say the masks need to be worn, and that's what all provinces and territories are saying. Masks need to be worn at this time indoors for sure.
So I'm also going to ask a question from Joe. We had a couple questions, but one of them was, is it better to get first and second shots with the same vaccine? And if so, what tests are done to support it? But he also wants to know a bit more about, originally, and you talked about this, originally it was only up to a month between shots, and now we're saying 3 to 4 months. He just wants to get, I guess, a bit of an overview again of what testing has been done, and wants to know, why we're not following the advice of the suppliers themselves.
Right. So there's the 2 different questions there. One is about, first dose, second dose. And as I said, the guidance on that is expected to come out next week. There is essentially studies from Spain and from the UK, randomized control trials that have been undertaken to compare mixing and matching of different vaccines. So we're going to have that guidance coming out very soon based on that data and data of hundreds, if not thousands of people. So that's really good because we're going to benefit from that. We didn't have to do those kinds of trials here, although I will say we are doing those trials here. The Canadian study has begun across the country to study the effectiveness of mixing and matching doses, but we want to be able to make those decisions sooner than later, and we'll of course update things over time. But as I mentioned, the safety data is showing good positive signals around the use of those different vaccines, but we're not ready to pronounce on that until NACI comes out with its advice. The second part of that question, I think, was about why the change in dose intervals. So the vaccine companies were in a race. The whole world was in a race to get vaccines developed as soon as possible. What that meant was they made decisions about an interval to test in their trials, and they chose something over 2 weeks because we know it 100% takes over 2 weeks to develop immunity after a dose of vaccine. That is just what decades and decades of research have shown. So it doesn't make sense to have an interval of 2 weeks or 3 weeks. And that's typical for many, many different types of vaccines. So they chose the shortest interval possible so they could get the trials done. They didn't want to follow people for 8 months, 6 months, 3 months, even 3 months. They were trying to get these vaccines studied. And so they did a short interval. But there wasn't any particular reason to choose 3 weeks or 4 weeks. And in fact, what we know from immunization research is that a little bit longer period of time actually gives your body more chance to build up those antibodies. And that's what we're seeing based on the evidence. So the National Advisory Committee looked at international evidence, decades worth of immunological evidence, and they did modeling to show what if we extended the interval between the first and the second dose, especially in a time of resurgence. Is it better to protect more people faster or only give a certain small percentage of the population 2 doses? And what they found was the whole country would benefit by having more people have their first dose. And that's why you've been able to see a really rapid increase, like I said, in the last 5 weeks of covering now over 55% of the population. If we were to have stuck to the 3 to 4 weeks, we would be at half of that right now in terms of the population having some protection. So that's why those decisions were made. What I mentioned is that with more supply, provinces and territories are decreasing that space. So it's not going to be up to 16 weeks. Most people are going to get their second dose before that, especially now that we have the supply to do that. So that's great news.
Great. Can I squeeze in one more, Laura? Okay, one last question. I know because you have to go, Kerry, but Katie was asking, is there a time frame for getting kids under 12 vaccinated?
We don't have a time frame for that yet. The studies are underway right now to do trials to test the vaccinations on children as young as 6 months, 6 months up to 12 or up to 11, I'll say. And there's a lot of really good reasons why we do it this way. We test vaccinations and their development on healthy adults. No one wants to risk. We need to understand how it works with people who have fully developed immune systems. And so that's why it rolls out that way. So you've seen that we have the Pfizer vaccine that's been approved for the use between 12 and 17. And in fact, Moderna is about to submit an application to Health Canada for its vaccine to be considered for use 12 and up as well. So that we expect that Health Canada will process that as soon as they can. There are studies, as I said, underway right now, but the evidence isn't, those studies aren't complete in terms of vaccination of children. So I think it's highly unlikely that we're going to see that start to happen in the next couple of months. Those trials have to be done. All the data has to be submitted. The safety reviews have to be done. We won't rush that. They'll be doing it in a rigorous way, but I think we don't have any firm timelines on that. But as soon as there's evidence and those trials are complete, Health Canada will begin reviewing them when those applications come in to get them done as soon as possible. But there is research underway, across the world to understand the immunity that young children have, and also modeling to show if we protect everyone 12 and up, will that provide enough population protection? Some people talk about herd immunity. Will it provide enough population protection to reduce the virus's impact, such that maybe it doesn't need to be vaccinated for young children initially? But that is still a question that the science and evidence is underway on right now.
So Kerry, I'm gonna, I'll wrap us up, but maybe I'll throw you two more topics that are just coming up in a big way, and you can give us the short version or the long version, and I'll let you manage your time. One is the issue of when you have one staff member who may not want to be vaccinated, and how do you keep people safe in that context, I think is probably the public health agency lane. And we'll take the question again a little later in the webinar, because we've got some of our guidance that we can help provide on that. But the second is vaccine passports, and if you can give any sense of where we might be headed with that, both for international travel, but also for in some countries where you might need it to go to the gym or the spa, or like, do we have any sense, and maybe we don't know yet, but where that kind of policy may be headed, or what the public health agency is thinking about that? So those are two different topics, but I'll just throw them both at you, and we'll thank you after that.
For the first one, thank you for that, Laura. For the first one around vaccination, so if one employee in a workplace chooses not to be vaccinated, and the others are vaccinated, they still need to follow those measures to protect themselves, especially if someone's immunocompromised or has some underlying conditions. So the distancing, wearing of masks would be really important layers of protection above and beyond vaccination. Because what people need to understand is vaccines aren't 100% superhuman. They are big heroes, but they're not 100% effective, because there's a number of things. Sometimes people's own immune systems aren't fully activated. And so then there can be a risk to transmit the virus. And so I think if an employee is not vaccinated, it's important that everyone in the workplace continue with those key measures that we talked about. And as the virus activity reduces, then those kinds of measures will be able to be lifted over time, but certainly not now. And I think the most important thing is that people provide, that a workplace provides the kind of credible information and resources for people to make those informed choices. And a discussion with the healthcare provider is also a good idea. In terms of the question around vaccine passports, so I can say the federal government's working really closely with provinces and territories right now, in particular on the way ahead for what we'll call proof of vaccine credentials, something like that. It's not a good snappy title. We've got to work on that part. That's really for international travel. So we know that everyone is quite keen to have the global mobility and connectedness that we've had before. And certainly countries are going to be looking for ways to look at modifying the border measures. And vaccination is one of those tools that will enable us to do that when people are fully vaccinated. So there's work underway right now to develop an approach for Canada we're looking at, and part of the dialogue internationally around international standards, so there can be interoperability between different countries' systems too, so Canadians can enter into other countries. So that work's underway right now. I think there's a couple different things. Provinces and territories are looking at whether and to what extent they want to use this within their province or territory in relation to access to activities, but in many cases it might actually be companies that make those decisions. You can see in some countries they've made flat out decisions. We are not proceeding with this type of approach in our country. But a company may choose to do that. There's a lot of considerations for that. Do you really want to reduce access to your customers? There's many other ways of ensuring, and there will be some people that might have an allergy to the vaccine, and where there isn't an alternative, although there are multiple choices, so there's not just one choice for a vaccine, so hopefully that can be resolved. But there may be a very small percentage of the population, for some unique medical reason, couldn't be vaccinated, and so there is an equity consideration for that. But certainly vaccination is not mandatory from the federal government, and no province and territory at this time are considering making it mandatory. So people have choices. They have options and decisions they can make. In terms of a vaccine passport within the country and how it could be used, that's really not, the federal government will not be making a policy on that for the entire country. So that more to come, but absolutely we will be having some kind of system to allow Canadians to travel internationally and come back into the country internationally. And we'll be looking to those gradual measures to ease the border measures that we have in place. And the vaccine passport, or if you want to call it the proof of vaccine credentials or certification, that will be a key tool in that toolbox.
Okay, well, thank you so very much to you and for your team for making the time to come on to our webinar and to help answer some of the questions. I know we have many more, and I know our team was working with your team behind the scenes to get answers, so maybe we can get answers to those questions and post them on our website so that people have the information they need. And thank you for the helpful links. We'll make sure that we're making all of that information available, and I know we've kept you over time, so we'll let you go, but big thank you from us for coming onto the webinar, Kerry, and the team behind Kerry. So thanks so much.
And thank you for organizing, and to all of your members for all the sacrifices you're making. We are, the light is beyond the end of the tunnel. We're getting there, and every day, every week, it's getting better. So thank you all.
Thank you.
Thanks.
Okay, so Corinne, I think we'll carry on with the second part of the webinar, which we might condense a little bit just because we kept Kerry a little longer and to answer some questions. But if we go to the next slide, Corinne, maybe we'll just stay up here and do this together. So Corinne found this one, and I have to say it did make me laugh because it's certainly been true for CFIB. We've been talking about digital transformation for a while, and boy, did COVID have a big impact on that for us, including these webinars, frankly, which we had been doing webinars a little bit before, but nothing like this. So hopefully that'll give you a laugh. We like to try and make you smile. On the next slide, Corinne, I think you wanted to give a quick update on some of the federal stuff, so I'll leave this to you, and then I'll be back in a minute.
Sure. So just quickly, we wanted to just make it known that the period 16 and period 9 is just about to come to an end for the wage subsidy and the rent subsidy. You can actually start applying for them on June 6th. And the next period, 17 and period 10 for the rent subsidy, which is June 6th to July 4th, is actually the last period under the current schedule at the same subsidy rates that we've been at now for the last several months. They are expected to start going down in the period after this one in July. But I just wanted to tell you that we have been hearing from some that are quite concerned that the subsidy rates are starting to decrease when some of them may not still be fully open. So we have been pushing government to reconsider this, in particular, given the fact that some parts of Canada, the opening plans for some businesses is not till later in the year or later this summer. So we do have a petition on this as well. So we encourage you to take a look at that if you're in that situation. So the more voices we have sort of pushing government to sort of maybe push the decrease of the subsidy rate back a couple more months would be a good thing. Also, the part of the budget had something called the Canada Recovery Hiring Program. That is a hiring incentive. We did talk about this in a previous webinar. There are details on how it's going to actually work in the appendix of this particular handout. But in a nutshell, it is to provide a subsidy of up to 50% on the incremental remuneration that you have paid to eligible employees between June 6th and November 20th. Now, you can't apply for this till after the period is ended. It's going to be very similar to the wage subsidy, but it does come into effect for that June 6th to July 4th period. But after July 4th is when you can apply for the hiring incentive. You can get either the hiring incentive or the wage subsidy. You can't get both at the same time, but you can switch back and forth between them during the months that they both exist. You can do one month if it's better for you, and then the other one the next month if it's better for you, and then you can go back and so forth. So that is essentially how it's going to work. And just to thank you. So that's something that's important. Also, CRA has given us a quick glimpse of the calculator they're going to use for the new hiring subsidy. They are going to help people figure out both at the same time, both the wage subsidy and the hiring incentive, and help you calculate which is the better one for your business. So that will be coming soon. We're hopeful that they're going to have something up that you can start playing with before that July 4th period, so you can start to see how it's going to work and what may be of greater advantage to your particular business. Move to the next slide. Quick updates on a couple smaller things. One is CRA has actually extended its business inquiry line hours. As many of you may know, there was extensive wait lines on that particular business inquiries line. So they've expanded the hours. It's now available Monday to Friday from 8 a.m. to 8 p.m. local time, and on Saturdays from 9 to 5 p.m. local time. So if you are trying to get through to CRA, maybe trying it later in the evening or on a Saturday may be a bit easier, because I think that's less known that they have been available then, but it has been open like that for a couple weeks now. And we wanted to let you know that the CBSA, the Canada Board of Services Agency, is launching a new tool called the Assessment and Revenue Management Tool. It launched this week. It is a new tool that will be required of all importers to use starting next year, but they are starting to get people to use it now. So if you're an importer or broker, a trade consultant, you might want to start looking at this. We will probably do a webinar on this if you are in any of those categories in the coming weeks, specific to how this will work and what it will look like. But they are now launching it. It's going to sort of change the whole importing process for any of you that are involved in importing. And your broker will be involved with that as well. But we wanted to make sure that you were aware that this was coming, and it is now launched. But as of right now, you don't have to use it, but it is encouraged to take a look at it. But we will have more to share on this in probably in July sometime. We're going to be doing a webinar on this. If we go to the next slide, I did want to sort of touch on a couple provincial things. Ontario has opened its sick days reimbursement portal. There's the link there. Just a bit info along with that for those of you in Ontario who may want to get reimbursed for sick days of employees who took time off because of COVID-related reasons only. There is quite a bit of information required, so you're encouraged to actually have your information ready because there's no save option. So we just want to give you those sort of tips if you're in that particular category. And there's also a dedicated hotline available via the WSIB, which is managing this, and you can reach them there. There's a phone number there for anybody who wants to be able to use that portal, but it is now open and available. And then if we go to, sorry, something you want to say?
I just wanted to jump in at one point and say I was just reviewing the survey that's going to go out to our members, the June survey. You know, we survey regularly, and we have some questions on sick day. Sick day policies are coming up right across Canada, something that governments are now considering making permanent. And so getting your feedback on that into governments in the various provinces is going to be important. So I just thought it would be a good place to comment.
Great. And if we go to the next slide, Ontario is not the only one doing this. Manitoba has also launched their applications for sick day reimbursement. So there's some details there. You can get up to $600. They don't have to be used consecutively those 6 days, but they can be claimed between May 7th and September 25th. So there is a link there to get more information if you're from Manitoba. There are a few other provinces that are also going to offer this type of reimbursement. We're not sure that their portals or their applications are open yet to do that. These are the two that we were aware of, but there are a couple other provinces that are going to be doing this as well. So we'll certainly share that information as we get it, and they'll all be on our COVID website as well. Next slide. All right, so moving into provincial reopening plans. There's been lots of reopening plans announced over the course of the last, I don't know, Laura, what, 2-3 weeks now, I guess. So
particularly in the last week, eh? I mean, there's been a big, it finally feels to me like we are turning the corner. Like this is the place we want to be for a long time. And
but we have 10 provinces and territories that have announced a reopening plan, all 3 territories, as well as the provinces listed here. The ones that we're still waiting for, though, are Manitoba, Nova Scotia, and Newfoundland and Labrador. I just heard today Newfoundland and Labrador have their budget on Monday, so they'll be announcing this later next week, their reopening plan. That is official, so they're coming, but we don't know at this point when Manitoba or Nova Scotia will be announcing theirs. So they're still, we're still waiting.
In fact, Manitoba just announced that they're extending their restrictions for a little bit longer. Manitoba's sort of ground zero for North America right now, as we know, for being in a little bit of COVID trouble.
Yeah, and I think the important thing to know that all of these reopening plans are sort of based on similar criteria. They look at vaccination rates, how many percentage of the population one dose. That's sort of one of the things they're looking at. The hospitalizations and case numbers remain important components of this, but they're all sort of based on, you know, reaching certain milestones in terms of these particular, and they have sort of estimated dates when they think they're going to reach those milestones. All of those 10 plans are actually in the appendix of this particular presentation. So if you're from one of those provinces and you want to see the details, please take the handout that's attached to this webinar and go into the appendix. Every province listed there, we have set up a chart with what the reopening plan is for each of those jurisdictions. And certainly in the future, if you're interested in us doing a bit more on the reopening plans, we can bring back sort of our team and crew from our regional offices to sort of speak to those reopening plans in more detail. That's something we'd be happy to do if that's something of interest to those that are on this particular call.
Yeah, I think that one of the other important points to make is that while the dates vary a little bit, with Alberta being sort of probably the earliest, and then Saskatchewan is also very early. Alberta's talking about early July when things will be back to normal. But in most parts of Canada, it looks like, you know, by kind of Labor Day weekend, that's the hope. Again, if the hospitalization numbers cooperate and the case counts cooperate, that we'll be back to normal early fall. So really nice to be on this webinar, Corinne, as we look back on it and actually have kind of some dates now for, you know, again, knocking on some wood, fingers crossed, but to have some dates. Yeah. For a finish line for this is really new, and I think giving people a little bit more of a skip in their step, which is not to in any way negate the many comments we're getting here about businesses that are still really struggling, particularly those of you in the events sector, and I'm going to mention in a minute that we've got a new petition on that, and you know, some of the ones that are going to be late to coming back and have been hard hit throughout the pandemic.
Yeah. For sure. So the next few slides, I believe, are on restrictions. Again, we don't want to really go through this in any detail. We have gone through this in the past, but we're happy to do some regional. But I think, again, for your information, you'll see here, and even just as you look, the green means things are open, the red means things, like the red cross means things are not yet open, and you can see quite a variation. There's, of course, the 4 Western provinces, BC and Saskatchewan, obviously a lot more open in many ways than Alberta and Manitoba at the moment, and as Laura mentioned, Manitoba is just extended. It says May 30th there, but now it's been extended another 2 weeks. It's actually June 14th because that I think just happened late yesterday or today. So that needs already to be updated. It's hard to keep these updated. If we go to the next slide, which is Ontario and Quebec, you'll see Quebec has actually started to reopen today. So much more open in Quebec than Ontario. But Ontario does have a plan and it's coming, but Quebec has started down that path, including, I understand they're going to have fans for Game 6 of the Toronto-Montreal hockey game on Saturday night, and it'll be the first sort of pro sports event with live fans. Only 2,500 in a venue of, I think, 20,000, but it'll be something that'll be a first in a long time. And then the last slide on this group, of course, is our Atlantic friends. There too, you'll see a lot more green other than in Nova Scotia. That's still sort of trying to get through and controlling a bit of an outbreak there. But even there, things seem to be on the upswing as well. And so things are a lot different in Atlantic Canada, as we know, and have been for a while, other than this blip in Nova Scotia for the course of the last few weeks. I think if we go to the next slide. Yes, well, we have a lot of
so we're getting lots of comments about, is there any, well, got one comment here about any more lockdown support for heavily affected businesses. And we've got a lot of petitions now that we're up, part of our going digital as to that earlier slide, and figuring out, working out some of the bumps is our new digital petitions, but we've got a petition page. These are our national ones. We also have petition pages for each province. So check it out and sign what you want to sign. Big thank you to Tim, who helped us with the Save the Events Industry petition, which is now up and running. And again, I just can't emphasize enough how the stories and the comments going directly to the politicians, as we're doing with these petitions, or in some cases we're still being a little bit of a middleman as we're working this out, but we're getting these petitions to the politicians, to the people who are in a position to make a decision about these things. And I cannot tell you how, I can't emphasize strongly enough what an impact they make on the politicians. And we're trying to make it really fast on your end to have a really good impact on the other end. And so here are some of the ones that are available.
Yeah, and I'll just mention, and Debbie asked if any news on grants for new businesses who open later in Q3 2019. Well, Debbie, at this point, no, but you'll see that one of the petitions here is new businesses need relief, and it is one of our higher priority areas that we're trying to still push government to do something about. So I wish I had better news, but I want you to know that this is high on our radar and is one of the petitions, so we encourage you to sign it as well.
Yeah, yeah. Good, and then I think we are going to the next slide. And Corinne, we usually do this at the beginning, but we're just before we've got time for, I think, a few questions, but this kind of reflects a little bit more of a hopeful sentiment that hopefully the year to come is going to be a lot happier than the one that's in the rear view near, what is this, Q6 of 2020 we're in right now. We're almost through. So, but it does feel like there's more hope out there now than there was even just a few weeks ago. So, so there you go. And then got another quote, another just quick information for you again. And our next webinar, Corinne, you've been hearing a ton, and as we have through the helpline on insurance and other costs. We're also hearing about construction costs, but insurance is the focus of our June 10th. You've lined up the Insurance Bureau of Canada, and we've seen hard markets before. Often there are some tips, some practical tips that can help a little bit. I mean, they don't solve, they're not magic, but they can help a little bit, particularly if you're struggling to find insurance. That's something often they can help with a little bit. So that'll be the focus of the June 10th webinar. Didn't put it on the slide, but I should have. Our AGM is next week. And so you will have gotten a notice as a member about our annual general meeting. It's 6:30 Eastern on Thursday. One of the great things about going digital is that we have a virtual AGM, which means that we have members from across Canada can come, and it used to be sort of held in a downtown Toronto hotel, which would be a little difficult for members in other parts of Canada. There's obviously a really boring part of an AGM where you're going through kind of the numbers and the approvals and that kind of thing. But we're also, Corinne and I are also going to be there, and we'll do a very mini version of these webinars. And it is our 50th anniversary. So in honor of our 50th anniversary, we've got a pretty cool video actually from Paul Martin that I think illustrates the fear that finance ministers have sometimes of the information that we're, or the positions we're taking based, of course, on your feedback, but also how much pep in the step it puts when small business through CFIB is saying, yes, good job on these policies. And it's quite a cute little video. So that alone, I think, is kind of worth it, Corinne. It's kind of fun. And John Bullock, our founder, will be there. And so yeah, if you're interested in that, sign up for that, and we'll be happy to see you there. And I think that's it for the like regular portion, as Corinne said in the appendix. And maybe we'll just flip to one of those just to show people. If we could flip down to the first slide in the appendix. Yeah, so we've got for every province what's going on with reopening. As you can see, there's a lot of detail, but if you want to check that out for the provinces that had reopening as of yesterday evening when we were finalizing the webinar deck, it's all here for you, and in an easy, hopefully relatively easy to digest format. So we've got that for Alberta, for Saskatchewan, Ontario, Quebec. So they're all there in some of the Atlantic provinces.
Correct.
And with that, I know that we are at the hour, but we'll maybe just take just a couple of questions, Corinne. Obviously, some of you may need to go, but I thought it would be good maybe to get back to the question of the really practical part of, as we move into a time where the restrictions are changing and we're not fully vaccinated, but we're more vaccinated, and how do you deal with masks and customers and all of that. And we've got some practical tools to help with that, including a vaccine policy that is available through the member portal that you can use if you choose, if you would like to do that. And actually we've got a question for that that Rachel has answered, I think, from Tom, on who hasn't been able to find the vaccine policy. But I wonder if we could pull Rachel or Brendan or both up just to say a word about what are you hearing on the helplines about, and what are you telling people when they're calling you with the question about, hey, somebody's not how do I talk to my staff about vaccines? I mean, this is really practical stuff, right, that people have to deal with. What about masks? Are you hearing more about customers not wanting to wear masks, or what are you hearing on the helplines? And maybe we'll return to that, and then we'll end the webinar with that. I know Corinne's answering some questions, I can tell, but I'll get you, Brendan, to maybe talk a little bit about the new policy and what to tell members.
Yeah, thanks for that, Laura. And there's a lot of, we're kind of getting into that mushy middle area in some provinces. I will say it's probably a welcome mushy middle area, because finally it signifies reopening. But if we use BC as sort of a study, a case study, and what we've seen from that province is that they're sliding generally over 4 phases. And those 4 phases are actually going to move pretty quickly, because they tend to, the goal is to move the province to complete reopening by September. But the first 3 phases are going to be sailed through pretty quickly by mid-July, as long as things continue to progress the way the government wants to see it progress. So that includes things like vaccination rates. They want to see at least 70% of the population with 1 dose at least. They want to see case rates and hospitalization rates and death rates going down and continuing to go down. So they've left themselves some room to re-implement safety measures if they need to, but they have outlined a path toward complete reopening, which is really nice. Now, what that looks like is that right now they're in phase 1 of the reopening in British Columbia. Phase 2, they're going to recommend mask usage, but not require mask usage. And so we're getting a lot of people phoning in saying, what the heck does that mean? I want some solid guidelines. Well, what that means is that you still have the ability to create workplace policies to enforce mask wearing amongst your staff as well as your customers, but that it's not required by law anymore. So if a customer comes in and they're vehemently against it, now you can service them without concern for being fined as a business owner. So what we're saying is that, look, it's still your business, and you still, to a degree, get to run it the way you would normally run it before COVID times. What that means, you need to have written policies in place that you can refer back to if you're ever challenged on that by an employee or by a client or a customer. And you need to be able to, on some level as well, justify it, because let's be honest, there's going to be unhappy people on both sides of that fence, no matter what kind of policies you put in place. And if you can refer back to, public health orders either still being in place or not being in place, or safety measures that, may impact your workplace, then you have a lot better chance or opportunity of de-escalating situations that can get pretty escalated. We also recommend that you train your staff on how to de-escalate customers, and you have a policy in place on how to deal with those who are upset, just as you would have before COVID, quite frankly. Now, in regards to our vaccination policy, obviously this is one that we've approached very cautiously. CFIB, we have no position, we have no doctors on staff, no lawyers on staff, and so we don't take a position in regards to vaccination. What our job is to provide you as a business owner with those resources to manage the situations that come in, because believe it or not, it's going to be on your doorstep. No matter which way you believe, if you're pro-vaccination, anti-vaccination, pro-mask, anti-mask, it's going to come to your doorstep and you're going to have to deal with it. So what we've done is we've had the Sherrard Cuz law firm draft this vaccination policy for your workplace that more or less offers guidelines on how to address certain situations. So whether or not you'd like to incentivize your employees to be vaccinated or not, whether you'd like to recommend it, strongly recommend it. This policy is actually fairly light in that area. It suggests that it would be nice if your employees got vaccinated, because obviously for you as a business owner, that impacts your WCB premiums, it impacts your sick days, all those types of things, but it doesn't require it. And by law, what we're seeing right now is that outside of healthcare workers, outside of some unionized workplaces, businesses can't require their employees or their customers to be vaccinated to come in. And in fact, doing so and imposing that upon them might put you at risk for a human rights lawsuit. And so what you'll find with this vaccination policy is that it's a fairly softly worded policy, and we do encourage you to have a meeting with your staff about this policy to discuss it. And quite frankly, with any workplace policy, you don't want to implement it with an iron fist. You want to introduce it and have a discussion among staff. And if possible, get their buy-in. Get their buy-in in regards to how to implement safety going forward in the workplace. Is everyone more comfortable if you want to continue with a mask mandate in your workplace, even if the measures are lifted by the province? Have a discussion. Once you can get the workers on board and being part of that decision-making process, you're going to find a lot more of a harmonious workplace going forward. So it's obviously a very broad topic in regards to vaccination in the workplace, but we are happy to have that discussion with you in Business Resources. And I do encourage you, if you have specific questions that we haven't gotten to on this webinar, do give us a call. Our counselors are prepared to have that discussion with you and prepared to help guide you through potentially how to deal with the unpleasant areas of vaccination, as well as maybe help you to be a little more proactive in how to manage your workplace in that regard.
And what's the best way to get the policy right now if members are interested in accessing it? Because I know you can always call our counselors like Brendan, and they'll send it out to you. But we don't have this one available on our website. It's through its member portal, if I understand correctly.
Yeah, so you'll need to log in through your member portal. So to go to your dashboard through the CFIB.ca website, log in, and then you can access it there. There's an a la carte menu actually of not just this policy, but I think 20 others. We intend to grow that library to an extreme level very soon. But if you can't find it there, you have issues with that, please do call us at Business Resources, and we'll make sure we get that policy among any other policies you might like into your hands. And not only that, but we'll help coach you on how to implement these type of policies and how to navigate any potential minefields, quite frankly, that are forthcoming.
Yeah, that's great, Brendan. So a lot of our tools are available just on our website and available to anyone, but we do have some tools that we have for members only, and hiring templates, privacy policies, that kind of thing we have available through this new library. But call a BR counselor if you have any trouble at all, and we'll make sure that that you get that. And again, that's only for members who want that as a tool to help them have these discussions in the business. And I imagine we're going to get a lot more questions about this. How do you handle if you've got some who are vaccinated, some who are not, and what that means about wearing personal protective equipment? This is going to be a fluid discussion, I'm sure, as cases and hospitalizations change, and all of those indicators are kind of changing rapidly for the better, thankfully, in most parts of the country, which is great. Okay, well, I am going to, I know, Corinne, you answered a number of questions, but I think this would be a good place to probably wrap up for today. Brendan, since you're here, if you want to impart any last thoughts or wisdom on our members, that would be fine. Maybe I'll start with you. I'll go to Corinne, and then I'll bring us home.
Yeah, absolutely. Thanks, Laura. So one other point to make, and we've had a lot of questions actually on this on the webinar, is can I require those employees who are not vaccinated to do certain things that I don't require of other employees who are vaccinated? So in relation to continued mask use or distancing. And you should be aware that the answer is no. Like any workplace policy, it needs to apply to everybody evenly and consistently. And if we ever single an employee out for those types of things that are outside of their performance or attitude control, we do risk a lawsuit. So I encourage you, before ever implementing or creating disciplinary measures and things like that, do give us a call at BR. We'll keep you on the right side of human rights, employment standards, and workers' compensation. Outside of that is just sort of a general sign off. 50 episodes, webinars later, we're finally here toward that exit point, I think, from the pandemic. And you know, if you've made it this far, then you're obviously very, very strong, and just hold on that little bit extra. Obviously, CFIB continues to fight to continue to get you that financial support while you come out of this difficult time. And BR's Business Resources, is continuing to create these types of policies and trying to help you navigate your way out of this as we manage our staff as well. So just know that we're all still very much here for you, even 50 webinars later. And the end, in a good way, is near, I hope and I believe. And just know that we're all in your corner.
Thanks, Brendan. Corinne?
Yeah, I mean, thanks again for joining us. Hopefully you found some of this information useful. We will probably go back to our normal Thursday time slot for the next webinar, because we know Fridays aren't always the most ideal. But thank you again. As Brendan said, you know, we're hopeful that we're close to the end, but we know it's still a bit of a struggle for many of you. I think that, you know, the quote we had at the end, there was just something visual about it I really like, that over the horizon, hope prevails, and essentially this means things will get better and things will be happier. And so I think that's something we're all feeling at the moment. So thanks again for joining us. As always, we're here to answer questions or just be a listening ear. Our counselors are excellent at that. Laura and I are also happy to do that. So anytime, please feel to reach out, and we'll hope to see you again in a couple of weeks.
Thanks, Corinne. Thanks, Brendan. And I'll just bring us home by, I love the quote you chose, Corinne, for this webinar. It does finally feel like, I kept thinking we were almost there. I don't know, like after the second wave, and then the third wave kind of crashed on us. And, you know, it's nice to feel that, again, knocking on some wood, that there's some hope that, and it really does feel like the light at the end of the tunnel is getting closer rather than further away. As I commented about a month ago, that it was feeling like it was so frustrating for Canadians, because it was like there's the light at the end of the tunnel, but something felt like it was getting further away, and now it really does feel like it's getting closer. So yeah, hang in there, you're our heroes. 50 episodes in, and it's kind of amazing, the journey we've all been on. And I was reading something earlier today talking about how this this was talking about young people and the hard times they've had, but what a gift it might be later on to have gone through you know, a really tough time and get to the other side is also has its own silver lining. So, you know, it doesn't always feel like it. Maybe it's too early for that, but maybe it's too early for me to be saying that. But anyway, we wish you well. We hope to see you at our AGM, and our next webinar is on June 10th, and probably at our normal Thursday time. And with that, we'll wish everyone a happy weekend, and we'll talk to you all soon. Thanks, Corinne. Thanks, Brendan, for helping. And thanks also to all of those folks that are behind me, Corinne and Brendan, to help make this happen. And we'll see you all soon. With that, we'll end the webinar.